Hey, good morning everyone, it's Ange from Digestive Detective. I thought I'd do my topic early today for Thursday's tip because it does involve poo and I don't want you to be watching it at lunchtime. So what does poo say about your health? So poo is something that we never really talk about unless you're a 7-year-old boy or me who talks about it all the time. And it's a terrific indicator of what's happening with your health, you know. So your poo is not only the leftovers from the food that you've eaten, but it's much more. It helps get all the toxic substances that are in your body out. And it's 75% water, it's indigestible fibre, it's the gut bacteria, some living and some dead that is moving through and coming out. It's the old intestinal lining cells that you have, it's medications that you're taking, and it's estrogen that's been recirculating in your body. It's the way to clear it out. So what qualities are we looking for with poo? There's a couple. So colour. The colour of poo comes from the breakdown of red blood cells and bile. Most like a melted chocolate colour, sorry folks, between milk chocolate and dark chocolate, somewhere in between there is the perfect colour. But poo comes in many colours. So this can be a result of what you're eating. So if somebody tells me they've got a red poo, I always say, did you have beetroot? Was that part of your dinner last night, a beetroot juice or a beetroot as a cooked thing? So it's really great to check that out. But if you have poo that is either white or yellow, you should seek medical attention for that, because that's something that you want to go and get checked out there. It's sort of an indication your liver's not doing what it needs to. So that's something you should check straight away. And whether your poo sinks or floats, that's another really important thing. If your poo sinks, it means it's got enough fibre. If it floats, it tends to mean it can be filled with gas, or you're not eating enough fibre, or you're not absorbing fats properly. So there's some things to look at if it's floating in the toilet when you look back. The smell. Really, poo shouldn't smell like anything other than poo. You know, if it's got a really toxic smell, or if somebody walks in and they can't go into the bathroom after you, then you need to seek help, because poo should not smell like that. Sure, it will change sometimes with food that you eat. You know, so if you have a curry, it might be a bit stronger the next day, but it shouldn't be overly, you know, toxic so nobody else can go in after you. You know, health conditions like celiac disease, Crohn's disease, chronic pancreatitis, all those sorts of things can, or malabsorption like lactose intolerance and stuff too, they can actually give you an increased smell. A poo should be easy to clean up. You know, one wipe and you're finished. You shouldn't see food in the stool. All right, sometimes maybe corn or tomato skins if you haven't chewed them properly. But if you're seeing food regularly, means something higher up's not working, your hydrochloric acid's not doing its job. So that should be an indicator that you might need digestive enzymes or something like that. So when you get the urge to go for a poo, it should be quick, it should be in and out. There should be no reading your iPhone or no reading a book in the toilet. It shouldn't take that long, because the more you sit, the more downward pressure you put on your whole bowel and your whole digestive system, and you could end up giving yourself hemorrhoids. So don't sit for a long time. Another thing that's really useful is get a stool. Put your feet on a stool so your thighs are parallel, and that way that helps open the valve, the two valves between your rectum and your anus, to help the poo come out. So that's a really good tip. Makes it quick and easy. It should be quick and easy. It should be no straining, no pain, and easy to pass. And how often should you poo? Well, in a perfect world, it would be food in, food out, but that's in reality, that's really not the case. There's only a couple of people that go 3 times a day. So 1 to 3 times a day is perfect. And on the Bristol stool chart, there's a couple of things to think about. So if you haven't seen the Bristol stool chart, it's a chart that lists the poos in order. So if you're having pebble poo or rabbit poo, means that you're probably not drinking enough water, or you're having problems with your transit time. So what happens with poo, all the water gets absorbed into your bowel to make the poo, and then it comes out. So if you're not drinking enough and you're dehydrated, which most people I see are chronically dehydrated, that then you'll end up with the pebble poo. So you want something somewhere between like a smooth banana and comes out in one big long piece. That's the perfect poo. Not so much if it's breaking off into little bits and it's fluffy or it's liquidy. They're not such the perfect poo. So if you're not having, you know, a smooth banana shaped poo once a day, then you probably need to get that investigated. So there are many things that affect our poo. One is travel. You know, everybody knows that. You go away and you get suddenly constipated. If you change your diet quickly, if you don't sleep very well, if you have issues around sleep, that can actually change how you go to the bathroom. And changes to your daily routine. You know, when you don't eat the same thing, or you have a meal at a different time, that can affect your bowel movements too. Hormones also affect the bowel movements, and if you've got to have surgery or you're under a lot of stress, that will also affect your bowel movements. So think of all those things. If your poo habits change, you should always see a doctor if you have any changes in your stool at all. You know, if you are a constant 3 times a day, then all of a sudden you're going once every 3 days, you should get that investigated. Or if you've been going once a week and then you start going every day and you haven't been doing dietary interventions or anything like that, then you should also see a doctor. You know, it's probably nothing, but it's always great to get those things checked out, because it is not your normal, you know, way you go. So the other thing I would like to say to everybody, look back. I see so many people that don't even look at their poo. They can't tell me what color it is, what it looks like, what it smells like, anything. So please, it's a really great indicator of health. Look back and see what you're actually producing in the toilet, and then so you can work out whether things aren't going as well for you. And the other thing is, if you need help around this, jump onto my website, book in for a free 15-minute, and I can talk you through some steps at what you can do to improve the quality of your poo. And I'll talk to you next week I won't talk to you next week actually, because I'm actually away next week. So I'll try and fit a tip in Wednesday and see how we go. So have a great day, everybody. Bye.